every year and make suggestions and updates as appropriate. Each type of cancer has its own standards for screening, and I'll go into those now. Sorry, I'm not good at public speaking. First, I'll talk about lung cancer. You should be screened if you're a current smoker or you quit within the last 15 years. You should be screened if you have at least a 20-pack year history of smoking, which means you smoke a pack a day for 20 years. You should also be screened if you're between the ages of 50 and 80 and in otherwise good health. The way we screen for lung cancer is a low-dose CT scan. Before you get this scan, if you're still a smoker, you need to be counseled on quitting smoking. The next thing is you need to know the benefits and the limitations with low-dose screening. And thirdly, you should have the screening done at a facility that is well experienced in cancer detection and treatment. Next I'll talk about breast cancer. Beginning at age 40 to 44, women should be offered the choice to begin annual screening. At age 45, you should be screened annually up through the age of up to the age of 54. After 55, you can be given the option of having a screening mammogram every 2 years, or you can continue with annual screening. I personally recommend annual screening for as long as you're healthy and then you have at least a 10-year lifespan, because you never know, so get screened. There are lots of risk factors associated with the development of breast cancer, and some of these include, of course, family history, genetics, obesity, smoking, and not getting screened. Of course, monthly breast self-examination is the most important aspect of screening for breast cancer. If you notice a change, you should consult your healthcare professional immediately so that it can be investigated. Next, I'll talk about colorectal cancer. Now, there are two types of people who should be screened. There's the low-risk individual, or average risk we call it, and then there's the high risk. High risk patients are followed very, very closely. Average risk patients, as we see on TV with the Cologuard commercials, are individuals who should be screened. The first screening should take place at age 45, and usually this is done with a colonoscopy. Following that, it should be done every 10 years if the study is normal. If it is abnormal, then follow-up will be recommended as appropriate. Also, an average risk individual should undergo screening until age 75, and then after that, as appropriate, depending upon signs and symptoms.